we're getting ready to visit with? Everybody over here, over here. If you've got an obstructed view, just try to scoot around the pole so you can see this way. Our next speaker is Beth DuPree. Let me tell you, it's hard for me to introduce her. There's very few people who have meant as much to me in my career as Dr. DuPree. You know, I always thought of myself as, I'm a pretty kick-ass guy. I thought, I know what I'm doing, and I know how I'm doing things. And I never realized how I didn't until I met her. We all think, we do it well, we do it right, we see how things should be, and then we forget so much of the human side of medicine. We don't realize what goes on. We think we do, but we don't. 10 years ago, I was sitting in a meeting in San Diego, and she fundamentally changed my life. I realized how the patient perspective was and who I was. It was, honest to God, a religious event in my existence. No person's meant more to me from how I see myself and my patients and the world than she does. She always puts the patient where they need to be, in the center of care. Not just the disease, but the patient. And we all think we do. When you hear her speak, you realize, oh my God, this is sort of our Sherpa on how to get there. She spent her whole life up in Pittsburgh and that part of the world, so I don't know how in that cold, miserable environment she's done so much to warm so many lives. But she does, and she is a wonderful person, and I can't tell you there's any person I'd rather have you here than her. So without further ado, this is Dr. DuPree.
It's really an honor to be here, and it's not that cold because we know how to dress up north, but I was a little chilly up there in the auditorium. First of all, I want to say the speakers this morning were amazing. I know why Walt loves it here, because if you guys in this room get to work with these amazing physicians and practitioners, you're very lucky, because they're very passionate, they're very data-driven, and I can tell that even Peter Beich was like totally, I was blown away. I don't think Peter's down here, so I can easily say that. So I'm going to kind of shift gears a little bit for you and talk about a subject that is incredibly important to me. It's really the topic of healing. I call this talk from surviving to thriving, because what we were looking at this morning was all the data on outcomes. And we look at outcomes based upon disease-free survival and overall survival. I have another capacity for looking at survival with my patients, and I look at it as, are they just surviving or are they thriving? All right, which way do I go forward? Hello, somebody. Mr. Computer, let's see, is it on here?
Here comes the guy.
All right.
Bottom one.
Which one? Bottom button? Okay, so I apparently, there we go. Is that the wrong one?
No, you're good now. We're doing your question.
Okay, so these are my questions. Healing from breast cancer diagnosis is synonymous with curing a breast cancer. And if you forgot your little keypads, don't worry about it. And hopefully by the end of this, our little hour together, you'll understand the answer. Shall we just skip the questions? I think we're going to skip the questions in interest of time. Can I do that, Walt? Am I allowed to do that or not? They're not working, apparently. Just so you know, I have this thing with energy. No matter where I go, I demagnetize the keys. I can shut down systems. I try to get meditated before I get on an airplane because I want to be able to take off. Okay, we're skipping. Yes! Which proves to me that what you're about to learn is not something that you had to answer a question for. But this isn't working. So, I told you, this is the energy thing. Anyway, so here's the deal. I'm a breast cancer surgeon. I trained in Pennsylvania. I went to college at the University of Pittsburgh. as Walt remembers. I spent my sophomore year at the University of Hawaii because I do like to be in warm weather.
You have to use the left.
I have to use the left and right key. I am so adaptable. This is good. Did my surgical residency at Albert Einstein in Center City, Philadelphia. Trained in the Knife and Gun Club like everybody else in trauma back in those days. And I can't tell you how old I am because then you'll know when I trained how old that makes me. You don't need to know that. But what was really important about all of this is that this has been a journey. This hasn't just been a one-day process where I woke up and said, I understand about healing. So I truly believe that the adversity that our patients go through helps them to evolve as spiritual beings. This is a picture of my brother. I am the 7th of 7 children, 6 girls and 1 boy, 7 kids in 10 years. We're not Catholic, I was my brother's last opportunity to have a little brother, and didn't quite happen. So I spent a lot of time with my brother doing a lot of wonderful things, you know, driving fast cars, flying airplanes, and my brother's passion was flying. He always wanted me to fly. That was like his one thing. He got his pilot's license when he was 16, got his CFI and became a flight instructor. And the day that I turned 16, he thought that I should get my license as well. But when I was 16, I was playing tennis, diving, playing volleyball, in school, chasing boys, all those things teenage girls do, and I had no interest in flying. And despite the fact that he tried very hard to get me to fly, I always said, you know what, I can do it later. I've got all these years ahead of me, and I was young. At the ripe age of 17, on September 30th of 1978, we'd finished my sister's birthday dinner at my parents' house. And little did I know that that time that I said goodbye to my brother would be the last time that I saw him alive. He was killed by a drunk driver driving home from my parents' house. It was one of those defining moments in my life, and although our patients experience adversity, we all have adversity in our lives. It doesn't have to be the diagnosis of cancer. For my parents, it was the loss of a child. For me, the loss of my brother. It can be the loss of anything that matters to you that pulls on your heartstrings. So I had a lot of choices in my life at that time to look at the adversity as an opportunity to figure out what I really wanted to do in life and make a difference, or if I wanted to just curl up in a ball and medicate myself with a lot of the things that we see people in our society doing with drugs and alcohol and different ways to try to numb the pain. So our patients do experience adversity, and that comes in the form of breast cancer. And it is a diagnosis that nobody is prepared for. What we learned from our last talk is all of those women that had no family history, when they get a diagnosis of cancer, it cuts them off, instantly, their knees, boom, onto the ground, flat out like a lizard, as my sister says. And there they are with this diagnosis of cancer. What do they do with it? What do they do with that diagnosis? And for me, I look at this diagnosis of cancer as it's our opportunity as healthcare professionals, not to just give them the latest, greatest, state-of-the-art cancer care, but for us to help usher them through the most difficult process that they may potentially go through. So we know the physical aspects of it. We all know that. We know what it does to the breast. We learned today that partial breast radiation therapy, if it's given as an external beam, may not give us the best cosmetic results. That's a big deal for us to discuss with our patients, but that's a physical component. We didn't hear a lot today about the psychological or the social components or the emotional and spiritual components. And those are the things that we as practitioners need to understand affect our patients, but they affect us as well. It's a diagnosis that produces fear. It's the fear that my cancer is going to come back, the fear that I'm not going to rock my grandbabies, the fear that I am not going to be who I am anymore when I look in the mirror. And that fear paralyzes patients. They cannot move. Women, when they get a phone call that their mammogram is abnormal and they need a biopsy, the paralysis begins. Because instantly in their brain, they're going through that ticker tape, oh my God, what if it's cancer? And they've already got this drama going before they have a biopsy, wondering who's gonna raise their kids. Because they know that that call can come to anybody. One of the funniest comments I get from patients are, I go for my mammogram every year. I go every year, how can I get breast cancer? And you heard it in the last talk. Mammograms don't prevent breast cancer, but they can prevent death from breast cancer. So as we go through this process, we need to know that when that phone call is made and that woman or that man gets this diagnosis that we believe that they have cancer, They are now paralyzed. They can't even think, you know, what am I going to eat for dinner tomorrow night? Because their mind has gone completely blank. We have the knowledge. As healthcare professionals, every single one of us, from the front desk person who answers the phone in your office, to your MA that takes their blood pressure, to your nurse practitioner, your nurse navigator, to your techs, to the chemo nurses, to every single doctor, every social worker, we have the knowledge to help them through this process. And it empowers them to make the right decisions. So I sit at my consult, first thing the patient says, am I gonna die? And I say, well, we're all gonna die. And they look at me, I go, I can't, you know, until we figure out a way to not do that, we're all gonna die. It's kind of it's a part of life. But for most of us, we don't think in terms of, oh my gosh, I've now become mortal because I have a disease that is known to kill. And that is a very sobering experience. But if you knew when you were gonna die, how many weeks, how many days, how many hours, how many months you had, if you had 1 week to live, you'd get up right now and you'd be out that door and it would not hit you in the butt as you climb up those steps to go do something that you absolutely love. But for most of us, we tend to put things off. We save for retirement. We obsess about things that we really can't control instead of actually doing the things that we truly, truly love. So this was one of my sobering moments. This is Babe, beautiful girl, horseback rider, great kid. She was born a week after my youngest son. So Dean will be 20 in a few days. And Babe was born like 10 days later to one of my best girlfriends from forever, my girlfriend Leellen. When Leellen was 39 now, well, I guess she was 39 then, she called me and she said, I have a lump in my breast. My mammogram's negative. And, you know, I'm calling you because I'm kind of scared because I know I feel this lump, but the doctor said there's nothing wrong with me, and my gynecologist says I'm too young to have breast cancer. I said, well, did you have an ultrasound? No. Get the ultrasound, core biopsy, it's cancer. She says, I'm flying to Pennsylvania, I'm out of here. She was in a state that has no genetics counselor, I learned that today. She came to me because she knew that as her girlfriend, not only was I gonna get her the best medical care, but I was gonna be there for her emotionally. So Leellen had treatment. She had early stage 3 breast cancer. I said, don't go on the internet, don't read anything. And we prescribed, did surgery, chemo, radiation, the whole 9 yards. At that point in my life, I was really learning about healing, and I was really learning about all these things that I could do to empower my patients. And she was like, healing, schmealing, give me the drugs, give me the radiation, like I want to kick this tumor's butt. So the PS is, it's 18 years later and Leellen is healthy and well and cancer-free. But 3 years ago, I got a phone call from her on a Sunday night. Her baby girl had been driving home from high school that day and was killed in a car accident. And suddenly, her world came crashing down, and so did mine, because one of my closest friends of my entire life, forever, loses a child, and I said, here she goes to this breast cancer diagnosis. But the things that she did different after her breast cancer diagnosis, changing her job, doing stuff she loved, spending all of her weekends doing her stuff with her kids, being the rodeo mom, I don't know, without that experience, would she have done all that stuff? She says yes, but you can't go back and explain why you do what we do. Fast forward 6 months later, another one of my best friends in my life, her son dies tragically. Still don't know why, still don't know all the details. But 2 women in my life, and these are 2 of the closest women that I've ever been with. And suddenly I realized that the lessons that we learn from cancer is that cancer sometimes just prepares us for those other life experiences that are even that much more difficult to deal with. So when someone says I'm going to die, I pull out my crystal ball, which I have in the center of my desk, and I roll it around. And I look at it and go, yep, you're going to die. I don't know when. My crystal ball's broken. And if I knew when you were going to die and how you're going to die, I would tell you that. But I don't know that. But what we learned is that every single day that we are on this earth is a gift. And the gift is being present in the present. And for so many of us, we're someplace else. I don't know if you notice how many people are digitally connected these days. You go out and you watch a family of 4 at a restaurant. Not one of them is talking to each other. They're all on their stupid little devices, having a relationship with an electronic device. I have a friend once when I was complaining about the digital world, and he says, but the digital world is my best friend. And it's the energy that we share between people that matters, not the time we spend on our devices. So every day's a gift, and we're only guaranteed this moment. So I say there's a gift that comes from cancer, and we can all learn from that gift. Cancer teaches us to clear the clutter. You know what a feng shui is? You clear the clutter? Well, I did this. And I had this crazy girl named Extreme Christine, and she ripped through my house. And I got a dumpster, and she said, how can you move forward welcoming in the things that you want in your life when you got so much crap, you can't even open a door without something falling out of you? How many of you have shoved stuff back in your closets and in your cupboards, and you just, and you're never going to use it again, but you might fit in those jeans, so they are not going to go to, bell bottoms might come back, and white go-go boots, so why would you get rid of it? But there is something so incredibly freeing and emotionally cathartic about clearing the clutter. And so I teach my patients to clear the clutter in their life. The first clutter is to get rid of individuals that don't honor you. Now, I'm hoping none of you in this room have had cancer, and I'm betting some of you have had cancer. The very first gift that you get when you get a diagnosis of cancer is learning to check the people off the list that you no longer need to be inviting into your life. And you've got to create balance out of chaos. Balance isn't in a box in your cupboard in the kitchen that you pull it out and you dump a little bit more in your bowl in the morning. How many of us feel out of balance in our lives? We're being tugged in every different direction. You're the mom, you're the caregiver, you're looking after your parents, you're looking after your husband's parents, you're looking after your husband, and you're not looking after yourself. And for so many of us, we give and give and give and give to the point that we forget to give back to ourselves. We've got to live in the moment. And this is a picture a long time ago, because I haven't seen those kind of OR hats in forever. But back when I was a young general surgeon, and I was trying to do it all. I was a trauma surgeon, I was doing general surgery, I was developing my breast practice, and I'd be in the OR, and I'd get a call from my office that there's some kidney emergency with an appendix or a perforated colon, and I would start to get a little scattered. And God love my nurses, because they just pulled me right back in, sat my rear end in the corner of the room in the stool and said, listen, you cannot be at two places at one time. You need to get focused. You can only be at one place at a time. And when you're in that one place where you are at that moment, you're going to do a better job. And so how many times are we one place thinking about something else that we have to do, and we end up getting behind doing what we're doing, thinking about where we're going? And so learning to begin to be and not just do. The beingness of our lives. We forget it because we're constantly doing our list of the to-dos. So, my other girlfriend that taught me an amazing gift, amazing lessons in life. Chrissy, crazy orthopedic surgeon, only a woman that I know that had a potty mouth worse than mine. I could tell when she was in the locker room when I was a young surgical attendant, because her laugh it was just so unforgettable. Chrissy was just skied the double diamonds of life, wonderful mom, great orthopedic surgeon. She didn't get along with all the nurses. I do have to fess up, because the nurses said, your girlfriend was sometimes not so nice. But I find that orthopods get very frustrated at times, and I got to give them a little slack, because they're dealing with sharp objects and hammers and saws and things, and I get to do this very delicate, eloquent surgery. But Chrissy's orthopedicness, she was an amazing friend. And when she called me one day to tell me that she had a foot drop, like she was having trouble getting over the diamonds when she was skiing. Within 8 months, she was diagnosed with Lou Gehrig's disease. And Chrissy was diagnosed at a time when I was beginning to open and understand what healing was about, where I was beginning to become more open about my spirituality with my patients and friends and colleagues. She thought I was a witch. She thought I was out there. But what happens is when you're diagnosed with Lou Gehrig's disease, you invite your witches into the circle and you go, listen, I need the cliff notes to spirituality. I don't know that this disease that I have can be cured, but I know that I need to learn about healing. And sometimes you learn the most about healing from those people that are closest to your heart, because we can't always cure our friends of the diseases that they get. We can't always cure our patients of the diseases that they get. But that doesn't make us failures as physicians or nurses. It makes us spiritual beings having the most human experience. So Chrissy taught me so much about healing. She taught me so much about this journey. And this is a picture from our pink pajama party, which we were told to have, because we were just supposed to be happy in pink and be in the moment. And we did. So, as you care for your patients, most important thing, prioritize their treatment. Give it in a timely manner. Make sure that, to us, 48 hours isn't a long time. To a patient, 48 hours is an eternity. Any way that we can coordinate the care to bring their team together is unbelievably essential and important for these patients. Clinical trials. You heard about so many clinical trials today that are absolutely defining how we provide the care for our patients. Our patients need to be put into trials, they need to understand it, and we are the access points, we're that knowledge. So it works as a team, because if the patients hear disjointed messages from the radiation oncologist or the nurse navigator or the clinical trials nurse, we have to be a cohesive team for them. We also have to encourage them to follow their treatments. When we were talking about neoadjuvant chemotherapy today, one of the things that I always tell my patients is no one ever dies of cancer in their breast. We die when cancer spreads elsewhere. So when we have those cancers that we know are going to need chemo anyway, there's something very empowering for these women to see those tumors shrink, to feel their breasts go back to normal. The clinical trials are going to give us the answer whether we need to do the sentinel node or not. But right now, what I can tell you is doing those therapies in that order gives our patients a sense of empowerment, because they see the effects of the chemo, they know how it's positively working. I'm also a huge fan of integrative therapies, and if I do a good job today, maybe Walter will invite me back to do my entire lecture on an integrative approach to breast cancer care, because we have so many opportunities to do things to help our patients, to decrease the chances of getting cancer, to decrease the risk of getting cancer back. But what I want you to learn about today is the cliff, because the cliff is a really important place that you need to know about with your patients. So it's 2 weeks after their final treatment. There's an article that was published in Breast Cancer Wellness magazine. It's still available online, and I encourage you to take the slides and pop it up and print it out for your patients. And that cliff comes whenever they're done treatment, whether it's surgery, chemo, radiation. I just had one of my patients in the office this week. She's a nurse. She does clinical trials for an oncology company. She finished her surgery, she finished her chemo, she finished her surgery, she just finished her radiation therapy. Was going through breast cancer with her identical twin sister at the same time. But the identical twin sister didn't have the exact same journey. And for this woman who's intelligent, who's fabulous, who's got it all together, she was sitting in front of me going like, I don't know what to do now, because she was no longer under treatment. And that is a very scary time for our patients. Because when they are coming to see us and when we are giving them something to treat their cancer, they feel safe. They feel like they're in that cocoon. So when the cliff comes, you need to know about it. So there's a bunch of different ways to be on the cliff. One way is when you're standing kind of in the haziness, and I know this slide looks hazy, and I could not find a good woman on a cliff that wasn't hazy, and I looked and looked and looked, and I said, okay, so I guess I'm supposed to pick the hazy cliff lady, because it's very foggy up there. They can't see where they're going. They're on the edge of this cliff, not knowing what tomorrow brings, because that life that they had before cancer is gone, and nobody's prepared them for the life that's ahead. Unfortunately, sometimes they go back to work and people are like, oh, cancer's done. It's almost worse when you have your hair and you have your breast, because people say, oh, well, you had the easy route. There's no easy paper route in breast cancer, just saying. Nobody gets an easy paper route. So, you can hang on for dear life, which a lot of women do. Men do it too. They even have a tougher time because they're dealing with a woman's disease. Or we can empower our patients to go for the gusto. And I prefer the gusto route. I have to tell you, Dallas, you had the most amazing sunrise this morning. I stood in front of my window and I just let that sun. You had the coolest moon last night, so I felt very welcomed. The sky was gorgeous, the clouds coming in. I was like, God was welcoming me to Dallas last night. So this is the point where we go from survivorship to thrivership. We base all of our statistics and our data on survival. I want us to base how we treat our patients on thriving. So this is a woman that I met, a nurse, on a medical mission to the Dominicans, one of the other side jobs that I do. We had spent almost the entire week together. This was the day that I was leaving. And one of the days we had gone up into the mountains after our clinic. And as we're walking up the thing, we're talking, because nobody knows what your specialty is, because we all just kind of go, it's kind of a primary care mission. And as we're climbing up the thing, you know, she's telling me the story of how she had breast cancer, but she didn't tell anybody, like nobody knew. She kind of kept it under wraps, because she's a nurse, you know? Nurses know how to take care of this stuff. You don't lose your breast, you don't lose your hair. Why? It's not a big deal. But when you hold it in and you cocoon this little thing away, and you don't exactly allow yourself to heal, you're not really giving yourself that gift of healing that we all give to our patients every single day. So she had another fear. She's afraid of heights. She didn't like the whole thought of like jumping off this cliff. And so it was very nice that I had to give this talk, and that same month I was in the Dominican, and there happened to be a cliff that all the kids jump off of, and that's my son at the bottom. We went to we were worried about people getting out because the waves crash against the rocks. So being the traditional safety officer that I am, I went and bought the rope and put the knots in it so we could easily climb ourselves up out of the rocks. But one of her friends caught her there, and not only did she jump, she splashed, she swam, and you could see this visible like cloud lift from her shoulders, almost like she shared that like secret that she'd been holding on to. But a lot of our patients are at that cliff, and they don't always have somebody down there in the water waiting for them to help them or to show them how to get out of the water or to how to swim a little bit stronger. So here's the cliffness. There's choices. For most of my patients, when they come back to the office, they're paralyzed with fear because they don't know what tomorrow brings. Neither do I. If any of you do in here, you might be clairvoyant and maybe have another job when you're outside of the hospital. The worst thing that can happen is if they free fall, because free falling means that they just close their eyes and they're letting it up to fate. And free falling could end you up on your feet or could end you up on your head. So free falling may not be the best choice. I am a pilot. I got my pilot's license when I was 18. That was part of my healing journey when my brother died, because I never let him teach me how to fly. And for many years, I beat myself up about that because I didn't take that opportunity. But instead of beating myself up about it, I got a set of wings. I got a flight instructor who, believe it or not, reminds me a ton of my brother because he's so passionate about flying. But if I can strap on a set of wings and learn how to fly to heal from my loss, our patients can do that as well. We just need to give them the tools. So they're survivors when cancer's done, their treatment's over, they resume their life, they follow up. But if the cancer experience hasn't really impacted their life, if they say that nothing has changed, it's a big fat lie, because everything changes. And people that try to hold it in and compartmentalize it and pack it away, it's going to come out at some point. So they're thrivers to me when their treatment's in the past, and they truly realize that even though they had cancer, the lady sitting next to them at the Starbucks is not guaranteed to wake up tomorrow and be alive. It's a sobering concept, but none of us are guaranteed tomorrow. So when we learn to live in the moment and be totally present, then we're allowed to get to that place where we have peace in our heart. And you don't have to have cancer to get this life lesson of what it is that you want to do. Because I love what I do. I get paid to do what I love to do. I am very fortunate because I give my patients hugs all the time, and I get a ton of hugs back. And I see my patients go through this journey coming in afraid and feeling broken. You know, breast cancer doesn't make a marriage fall apart, but a lot of marriages were falling apart before the breast cancer diagnosis, and breast cancer doesn't fix that piece of it. So what breast cancer does is it kind of like throws everything up in the air. And it's really about finding peace in your heart. But it's about all of us finding peace in our heart, because we can thrive in our lives and we can give better care to our patients when we as healthcare practitioners figure out what it is that is driving you from the inside. Because I could stand up here and be a motivational speaker, which I am not. I'm standing up here trying to inspire you to figure out what makes your heart sing, what makes you the happiest you can possibly be, because that is where we all become thrivers. So this is my dear girlfriend Lauren. and that is her baby girl, Francesca. I think she's in Washington now, and I think she's a junior in college, or maybe a sophomore, junior in college. Lauren is my breast imager. Fabulous, wonderful girlfriend. She and I did a lot of breast imaging biopsies and stuff together. She was an amazing body imager. When she was about 34 weeks pregnant with Francesca, she had a seizure. Go figure. Now you're thinking right now, I'm a high-risk person to be friends with because my friends are stuff. And I just believe that, you know, God puts people in your path so you can support each other and learn from it. And because I happen to have the biggest mouth, I ended up where I am. But Lauren looked at her own MRI after her partners looked at it, and we're like, yo, it's a stroke. And she's like, it's a brain tumor, guys. Like, what are you kidding me? Like, so she gave birth to Francesca, beautiful, healthy, gorgeous baby girl. Had a brain biopsy, didn't get a good prognosis or a good diagnosis. The one surgeon didn't give her great odds, and he was very not nice about the way that he provided that information. And you know, when someone gives you a certain number of months and tells you what amount of time you have to live, I say it's time for a second opinion and somebody that is going to give you some hope. Now, we all have to give bad news at times, okay? And I'm not telling you that we should tell patients things that we can't know. But if anyone in this room has never seen a patient that had stage 0 breast cancer but came back with stage 4 cancer later, despite doing all the right stuff and dying of that cancer, or someone who's got stage 4 cancer and we don't believe it's curable and treatable, and 20 years later they're disease-free, or NED as I like to call it, no evidence of disease. We do not have the ultimate answer to all those questions. Lauren, of course, she's a radiologist, had every complication under the sun. She got a bone flap necrosis, but she did her surgery, she did her chemo, she did her radiation. But the most important thing was the gift that she gave to me, which was she woke me up. And she said, listen, somebody at my church introduced me to this form of energy healing called Reiki. And I'm like, I Reiki my leaves, I don't know what you're talking about. And she said, this Japanese energy healing. And I was like, you know what? I don't have the answer how to cure your cancer, but I can be there with you. So, Reiki is an amazing form of energy healing. It does not replace my surgery. It does not replace my chemo. It does not replace my radiation therapy. It does not replace anything that Western medicine does to treat the cancer. But what the Eastern healing modalities do is it treats the person. It treats the individual who happens to have that cancer that walks into your office. And so Lauren's gift to me was teaching me what I didn't know about healing. And Lauren is currently our services navigator, so the prognosis of the bad doctor, well, he wasn't bad, he was a good surgeon, but he was just not the best communicator. Lauren is fabulous and wonderful. I bring intraoperative therapies into my OR. I do Reiki with each and every one of my patients when they go to sleep. And I've had patients say to me, you know, as I'm going off to sleep, I felt this life force. And some people think it's the verse that I choose to believe that it's the life force. But the difference is, you know, when I first started at my current hospital, one of the head anesthesiologists, he said, you know, once the Versed and Diprovan's on board, they're not going to remember a thing. And I go, well, you can think that, but you know what? Patients can recall these things. You should never say anything to a patient under anesthesia that you don't want them to repeat in a court of law. Because at some level in our consciousness, we know everything. And I will tell you, I don't care if my patients remember that I was there or not. I remember that I was there. I remember that I was in the OR with them, holding their hand, because it is a very scary time, and I take them through a journey of guided imagery. I ask them what their favorite place on the planet is. And we go there, because you cannot be focused on 2 things at once. So you can't be going to sleep afraid of cancer when you're at the beach, you know, sipping a cocktail, one of the limited ones that I allow them to have. But it's a big deal. So they become thrivers when they create the life that they deserve. Patients come into breast cancer with baggage. You may have figured that out. It'd be nice if they all had a carry-on. Some have an 18-piece set of luggage. Some of them come in and their luggage is all over the floor, and there's crap everywhere, and that baggage has to go away. The baggage that women and men come into breast cancer with, that's not our baggage, but we are part of that process to help them to get rid of that baggage. So they got to prioritize, and this is, I give my patients a pink rose quartz heart, And I used to give pink ribbons, and then I realized, oh my God, I'm giving them a sign of cancer to wear on their lapel. Like, it was a great idea. You know, the money went to cancer research, but I was like, oh my God, I'm branding my patients. So, number one is, if you're not the first person on your priority list, you can't take care of everybody else. Everybody in this room, if you're not the first person on your priority list, you cannot take care of your family, the patients, all the other people that you have to take care of. For all you nurses and office people who take care of doctors, you've got to take care of yourself first. And you got to teach us to do it too. So fear, this is the acronym out of Course in Miracles. False evidence appearing real. Peter alluded to this in his talk. Fear is something that, as we create this drama in our heads, as we create that dialogue and that story, fear will make you go to the dark places. And getting rid of the fear is the hardest part of cancer. I tell my patients at the very first consult, I said, the first company that comes up with an electrosurgical device that cuts the fear out when I cut the cancer out, I will be your poster child. I will sing it from the rooftops. I will want to use that device on every single patient, because I can physically cut a cancer out, but that fear remains. And if a woman has stage 1 luminal A, curable breast cancer with an all-red score of 9, and she is not going to get her cancer back, but she sits in her kitchen with the lights off, waiting for her cancer to return, have we cured her? Maybe. Have we healed her? Absolutely not. And if someone has a life that they're actually not living, what have we done for that person? What have we done for ourselves? So, we got to release the fear. So, everybody's heard of Lindsay Lohan and the milkaholic thing when she wanted to sue the people from the Super Bowl. Becoming centered on self is not the same as self-centered. Becoming centered on self means that you make yourself the priority in your life. You get into that zone, you figure out who it is deep down inside of you, what your soul's purpose is in life, and you become centered on who you really are. If you're self-centered, that's kind of narcissistic, like the world revolves around you, and we all know people like that, and we just choose not to hang out with them. Most important lesson of the day, rid yourself of energy vampires. By definition, they are the people, and we have patients that are energy vampires, and they get a little alert screen that says EV, so that when the alert screen pops up, you know that person's got to be at the end of the day, because they will suck the life out of you and not let you go on with the other patients that need you. Energy vampires can come in multiple forms. They could be spouses, they could be siblings, they could be parents, in-laws, neighbors, friends. If their people in your life do not lift you up and all they do is suck the life out of you, send them love and let them go. So, how many of you in your life have ever done anything that you feel bad about? You may not have done the right thing. We all do it. If anybody has gone through life without having a transgression, I will maybe come to the temple that you're going to be worshipped in. But so many times in life, we do things, and we need to apologize, say we're sorry, and then you got to let it go. Because otherwise, that stuff is living rent-free in your head, and that is not a good thing. Forgiveness. There are a lot of people in your life that do things that hurt you. And I was telling this to a patient the other day. She was angry because she felt that a radiologist misread her mammogram. I actually went and looked, and it wasn't a misread. So I was of course checking to see. But if your perception is that a radiologist caused your cancer to be metastatic, even if it's true, holding on to that is truly letting someone live rent-free in your head, because when we forgive to let go of it ourselves. When we forgive, it doesn't make what the other person did right. It just gets them out of your energy zone so that you can get on with the business of being alive and being happy. And self-love is so underdone. We need to love ourselves first and foremost. It's really tough. And by self-love, I mean loving everything about you. I don't care when you look in the mirror in the morning, you shouldn't say, oh, I could be thinner. Oh, I could have less wrinkles. Oh, you got to look at it and say, you know what? I look damn good in those wrinkles, and I earned every single one of them. If you don't love who you are at this exact moment, you can never get to where you want to be, because you're always ruminating and going back and obsessing over the stuff that you think you could have done better. And gratitude. Nothing like it. Gratitude brings more love into your life. The more grateful you are and the more positive things you put out, the better off every single aspect of every day goes. You know, you can walk into the office and you see one of your coworkers and you're thinking, oh my God, she should not be wearing those pants with that thong, but she has a really nice shirt on, and so you can be grateful that you didn't pick that pair of pants. But instead of saying, you know, you look really hideous in that thong, you can say, that shirt is really awesome on you. And be grateful for everything that you have in your life. We live in a world of lack. Everyone's trying to get everything. Like, we always focus on those things that we don't have. We don't have the bigger house or the bigger car or the better whatever, instead of looking at exactly what you have right in front of you. Because gratitude is something that, as you are grateful, you find more things in your life to be grateful for. So these are the pink hearts that I give my patients, and they are a touchstone. And to me, they are something that I didn't realize how important they were to my patients until I see them in their pocketbooks 10, 15 years later. Somebody loses one and they come back to the office like, oh my God, I lost my heart. I'm like, you can get another one. Somebody needed it. You know, it popped out of your pocketbook because somebody else needed to find that heart. But it reminds us of all those things that we need to remember. It's our list: the forgiveness, the apologizing, the self-love, the gratitude. So here's the other thing that I found in my journey as a breast cancer surgeon. I see way more people in my office with benign disease than I do with malignant disease. And I would be willing to bet you there's more people in this room that haven't had cancer than have had cancer. So this is your wake-up call, kiddos. This is Yanni. He's an amazing artist. My 40th birthday, I'm a big person about experiences, not stuff. And this was my 40th birthday trip. Went to Greece. It was awesome and fabulous and wonderful. And I met this amazing artist. I actually had met his artwork the island before when I saw this statue, and I said to my husband, I said, oh my God, I love the statue. I said, I was on the Voyage of Enlightenment on the Wind Spirit cruise ship with a medium and a guy that does past life regression. I'm just outing myself right there. But I found this statue and I said, look at this beautiful form. This woman is lifting her head off her shoulders. It's as though she's gone out of her physical body to get to this place of understanding that there was so much more to all of us than this physicalness that we're in. So my husband wouldn't let me buy the statue that day. He's like, I'm not carrying it home. Fine. So we get to Athens and go all over the place. Went to dinner, end up in this dark street. All of a sudden there's a light and there's Yanni in the statue. I said, this is a sign. I am meant to buy this. We're going in. So I went in. The guy was amazing. Like, the final exam of spirituality. The coolest guy ever. And that's me gloating because I got my way. I was getting my statue. And as I was sitting there, I looked up on the corner and I saw this other statue. And I'm thinking, I'm carrying one home, I could take a second. And I said, oh my God, I love this statue. And Yanni says, I call this statue the winners. He said, this statue is about women healing from breast cancer. And then I pulled my card out because he didn't know I was a breast cancer surgeon. He just knew I was an American with a visa. And, so I pulled out my card, diseases of the breast. And then he proceeded to tell me that he probably made this for me, knowing that I was coming. But he did it in a certain way, because he said every woman needs to be turned into the specific direction that she needs. We cannot write a prescription for healing for our patients. We cannot give them, take one pill, BID, and be healed. They need multiple different ways to turn, multiple different ways to find healing. We don't all do it the same way. And that was a really important lesson for me, because when I was young, I used to think I could do this for my patients. I could get them to that place. I could be everything that I could to get them to where they needed to be. But he gave me the greatest lesson of all, because he taught me that what I had to do was just show them that there's this journey that their body, that they're on in their lives, that their spirits are on, but that they would find the direction to turn in. And each and every one of us has the opportunity to do this. When you leave here today and you go back to work on Monday, hopefully a couple little things will just sink into your head and you'll realize that we all have the opportunity to change how the world turns. We all get to be a little pebble in a bigger pond. And when we make that ripple, we make that ripple from a place of love and light. We make that ripple from our core. We are changing the planet. We're changing the world. Dawn changed my world. Dawn was 32. She was about 32 weeks pregnant when I met her. She had a lump in her breast. And at the time that I met Dawn, I was a general surgeon. I did all aspects of surgery, and I was doing a lot more breast cancer. But when I met Dawn, she came to me with a breast mass, biopsied it. She was my first pregnant patient. And when I diagnosed her, Amy was her gynecologist. We matured the baby's lungs. She delivered the baby. Next day, sent her for her testing. One of the hardest things I had to do was walk into the room of a mom with a brand new baby and tell her that her cancer was metastasized. All through her liver, through the bones. For the next year, she went through surgery, chemo, and radiation, did everything. But she died a week before her baby's first birthday. When we buried her that first week of April, it snowed that day in the cemetery. And I knew that that was Dawn's sign to me. But what happened with Dawn was she gave me a very powerful message. You weren't able to cure my cancer, but you made my journey so much better because you cared. Because you were there, you didn't let go when you knew you couldn't cure me. And she was one of the reasons why I completely shifted my practice to breast care. I wasn't looking to get out of night call. I was a damn good general surgeon. I could take out a gallbladder like nobody's business. But Dawn taught me that how we do what we do is as important as what we do. So thrivers, they get perspective. We all need perspective every once in a while. You know, we get caught up in the crap of every day. Instead of looking at the blessings that we have in our life, we miss, you know, breast cancer survivors, women that have gone through breast cancer, men that have gone through breast cancer. Do you think they care as much whether their kids' clothing is picked up off their floors or their bedrooms? No. They care about what can we do together to create a memory, to create some energy together. They prioritize. Just like I said, you get rid of those energy vampires. You prioritize things in your life. And why don't we prioritize them now? Why don't we make time for those things that are important to us? My patients that get a benign diagnosis, I tell them, the universe just gave you a whisper. That list of 10 things you were going to change on your priority list should change not when you get cancer. We should change that list now. Every single one of us. The priorities in our life shouldn't be waiting for some underlying, myocardial infarction or some devastating thing to happen in our lives. It's time to do it now. Everybody's passionate about something. If we could all get paid to do what we're passionate for, there would be no wars, there would be no cyber security needs, because people would not be out trying to undermine other stuff. Passion drives us. And when our passion and purpose come into alignment, that's when we really get into our zone. When our passion and purpose are in our alignment, we are in the zone of what our soul's purpose was, what we were put on this planet to do. And again, I say I'm fortunate. I worked hard to get where I am. I worked hard to get the degree that I have. My parents didn't go to college. I was the first one to go to graduate school and, become a physician. And, surgical residency wasn't the easiest thing to go through. But you know what? I would do it again in a heartbeat, because I know that if I wasn't doing exactly what I do for my patients, I wouldn't be able to get up every morning at 5 a.m. and go in there and do it. And people say, oh, how can you call someone and tell them they have cancer? I don't give my patients their cancer. I may not be able to take it away, but I can make their journey better. We all do, we all can. And it takes perseverance. It's tough. It's one of the reasons why I like neoadjuvant chemotherapy, because when patients see tumors shrinking, they don't care. They put their big girl pants on. I'm gonna finish this chemo because I can feel my tumor going away. When we do chemo after surgical treatment, if somebody has a complication, it's very, very hard sometimes to keep them on that track, but we need to help our patients maintain that perseverance. You need to have that perseverance in your life to figure out what you're passionate about. And at the end, it's about peace. That's all any of us ever want, is peace. So here's the new cliff. I find it a little bit more appealing than hanging there for dear life and being in the fog. And that's my cliff. Happens to be in Sedona, Arizona on Cathedral Rock. But that is my Zen zone right there. And I will tell you, I've been going there every year, once or twice a year for the past 16 years. And I get there and I plug my cord into those red rocks. And I just suck all of that wonderful energy back in, because I give and give and give to everybody else. And I really realized that I have to continue to give to myself. And if I don't do what I need to do to keep me centered, healthy, whole, and complete, I can't take care of my patients. So here's the challenge. It's a long road, all right? It is truly a long road in life. But it's our journey that brings us our happiness. It's those moments that we're with our families. It's those little things. It's all of that stuff. It's not the stuff in life. It's those moments where we energetically share with those that we love. It's not the destination. So we measure our life sometimes based on the length of life that we have, but it's the moments in life that take our breath away that are priceless, not the number of moments that we're given. So when you leave here today, take home a few wonderful lessons. Be a leader, create the path, find your passion, find your purpose. If it doesn't bring you a paycheck, figure out how you can bring more passion and purpose into the things that you do, whether you volunteer, whether it's artwork, whether you're inspiring or empowering other people, but create your path. And at the end of the day, it's really about finding peace in your heart. That's all any of us ever want. It's that simple. We want bliss. If we had a bliss coefficient that we could measure and identify where we are in our lives, you know, it's that bliss coefficient that I wish that we had a standard table to identify this, because it's finding that peace in our heart again. And for our patients with cancer, it's about them getting peace in their heart, not being racked with fear, not being afraid of the shoe falling, but living truly in the moment. So if you ever want to know where my bliss is, that's where you'll find me, sitting on the top of the rock. So if I go missing, that should be the first place that you look. So I want to thank you for having me today. I know this was not like a typical CME talk, but what I want you to remember is we do a very noble job in healthcare. Sometimes we don't get the credit that we deserve for all of the healing aspects of what we have to do. It's those emotional things, that those phone calls. I still have trouble to this day calling my patients, even though I know I don't give them the cancer. But what we have to do as healthcare providers is remember to nourish and nurture ourselves, to give ourselves the big hug. I give my patients their hugs, but we got to give ourselves the hugs, because what we do matters. How we do what we do matters even more. And please leave today coming up with a way to make sure that you care for yourself as you care for your patients. Thank you.